How to change the tubing of your hearing aid depends on which type of hearing aid you have. If you have a slim fit hearing aid, the department will supply you with replacement tubing and domes, and they're changed at the same time. If you have two hearing aids, both the hearing aids and tubing are normally colour coded. So the hearing aid will have a little colour marker on it, and also the tubing will have a coloured number or on near the end of the tubing to show you which side is which. So it's red for right and blue for left. I would recommend doing one hearing aid at a time to make sure they don't get mixed up. First thing you need to do is remove the old tubing from the hearing aid. With some hearing aids, you do this by simply unscrewing the top of the tubing from the hearing aid. So you unscrew the old tubing and you screw on in a clockwise direction the new tubing. For other hearing aids, the fitting on the top of the hearing aid is not a screw fitting but a bayonet fitting. So to remove the old tubing, what you need to do is to turn the hearing aid to either 9 o'clock or 3 o'clock and pull, get the new piece of tubing and then push it straight back on to the top of the hearing aid. If you have a hearing aid with thicker tubing and a custom-made ear mould, you'll need a different method to change the tubing. And you'll also need some tools. You'll need a small pair of pliers and a pair of sharp scissors or a pair of cutters. You'll also need a supply of tubing from your audiology department of the correct size. Tubing comes in a few different types. Most hearing aids take the standard type of tubing, but some moulds need a slightly thicker tubing and again a slightly even thicker tubing. Some moulds use specialist tubing like this Libby tubing which has a flared end. You need to ask your audiology department for the correct type of tubing for you to be able to retube your mould. But most hearing aids will use a standard type of tubing. To start off with, what you need to do is detach the hearing aid from the mould and tubing. Again, if you have two hearing aids, it's a good idea to do one at a time. The hearing aid and the mould are both colour-coded. There'll be a little coloured dot on the hearing aid to show which side it is, and the mould usually has some writing on. Right-sided hearing aids have red markers and left-sided hearing aids have blue markers. Hold the ear mould in one hand and grip the tubing where it comes out of the ear mould on the outer side with a pair of pliers, and just gently pull with the pliers to remove the tubing. If it's difficult to get the tubing out, what you can do is you can roll the pliers round and round to gently ease the tubing out of the mould rather than pulling very hard. Now, if your tubing is very hard or your ear mould is very old, I would recommend first getting the tubing replaced at the audiology department, because there is a risk that the tubing or the ear mould might break while you're trying to do this. It's best to do this process only if your tubing has been changed within the last 6 to 9 months. When you remove the tubing from the ear mould, don't throw it away, just place it to one side. What you need to do then is take a new piece of tubing and then you're going to taper the end of the tubing to fit it through the ear mould. The tubing has a U shape with one end shorter than the other end. What you're going to do is you're going to trim the short end to form a point to be able to thread it through the ear mould. What you do is you get a pair of scissors and you start cutting about 2 inches from the base of the U to make a point at the end. So you start at the side and cut across the tubing using your finger as a guide to make a point. You might need to trim the ends there, just to make a nice sharp point. When you have the tapered tubing, then you start threading it through the ear mould from the outside. Again, you want to have the long piece of tubing, the long end of the tubing, pointing at roughly about 11 o'clock. You don't want it facing back downwards or to the side. You want it facing at about 11 o'clock. You thread the tubing through the hole. Till it comes out the other side, and then you gently pull the tubing through. You may need to use a pair of pliers to help you do this. You keep on pulling through until the tubing is roughly at a 90-degree angle to the ear mould. You may need to twist it round. When it's in the right position, then what you can do is you can cut the end of the tubing off on the inside of the ear mould using a pair of sharp scissors. To get the correct tubing length, what you then do is you take the old piece of tubing and line it up with the ear mould so that the bend is at the same place. Line the two pieces of tubing up together and then make a sharp cut. So now you have the ear mould with the same length of tubing as before. The last stage is just replacing it, pushing the tubing back onto the hook of the hearing aid. And again, you need to line the hearing aid and the mould up together so they're facing the right direction. And then you push the end of the tubing onto the hook. Usually the hook has a little lip on it that limits how far you can push the tubing on, but if not, you just need to overlap the tubing just by 1/4 of an inch or so to make sure the tubing's firmly attached to the hearing aid. And that will be the hearing with the new tubing attached to the mould. If you have a friend or relative to help you, they can always make sure that you get the tubing cut to the right length. So after you put the tubing through the ear mould and cut the end off on the side facing the ear, what you do is your friend or relative will put the ear mould into your ear. They'll place the hearing aid on top of the ear and use a pen just to mark the tubing to be cut where it overlaps the hook of the hearing aid. Take the hearing aid, the ear mould out of the ear and just cut the tubing where it's marked. Push the hearing aid back onto the hook, push the ear mould onto the hook of the hearing aid, and the hearing aid should now be sitting, the tubing should be cut so the hearing aid is sitting nice and neatly on top of the ear.